Welcome to FitTech Videos. This is video 3 of the parent-child release videos, and thanks to my son Joshua for helping us. Joshua is 9 and perfect age, and this is the age that, like I said in the previous 2 videos, is the perfect age that I start seeing a lot of kids, and they're starting to develop more, starting to play more sport. In earlier videos I had my daughter Jewel, 5 years old, and it's great to start at that age and for them to get used to the hands-on. You don't have to go in too much detail. With Joshua I can go a little bit more, and with your kids at the age of like 8, 9, going up into 14, 15, 16. From about 16 they're almost like adults. I treat a 16-year-old and up, I treat like an adult, exactly the same. They're then starting to get much easier for you to tell. But from the ages of about 8, 9 till about 16, that's Josh's age, it's also great to do a lot, and it's good for their development. So what we've done, in the first video we went through the lower body, in the second video we went through the arms, but a shoulder, chest and abdominals. Now I'm going to go through a bit of the back of the glutes, as well as the neck. So I'm going to get Josh to roll onto your side for me, facing this one please, boy. Great, and then lift the knees, bend the knees up, like that. Awesome. So I like to put a pillow. This is just a pillow I made myself. It's a normal pillow that I rolled up and just sewed in place and then put into a Continental pillowcase. Great way and I've been using this in my practice for years. I've got quite a few of them that I use, and this is a good way just to get the hips, stop the hips from collapsing, and then it's ease of access into the glute. So normally I'd stand on that side working on get nice and square, my boy. There we go. Normally I'd work on that side when I'm working on the back and the glutes, but for the sake of the video I want to stand on this side so you can see what I'm doing. So with Joshua now at the age of 9 and going up between the ages of about 8, 9 till about 16, you can start going a little bit more into the ITB. With Jewel I wouldn't have done that. You know, younger than 8, it's not really, unless there's a specific thing. And again, we're going to give, we would like our members to give us emails or messages, WhatsApps or whatever, to ask for specific videos. And one of the things we want to do is actually get you to even send us a video of yourself or your kid or something, and if you want us to focus on something we can analyze it and then give you some feedback. So that's also something that we want to bring in later on as part of our membership website. So what you can be doing is you can go in to the glutes, and it's very sensitive, as you can see the little kicks. So again, fast movements and then hold back, fast movements and hold back. Don't try and avoid getting in there and holding it for too long. The muscle's gonna counter contract, and it's not worth anything. So what you'd rather do is once you've warmed up a little bit, hold on to the foot, get in there, and then just lift the knee up to the ceiling. The knee up, there we go, and relax. Fantastic. You find another spot, lift up and relax, and again. It's easier once you move, eh? So when you trigger, it's a bit sensitive. As soon as you add a bit of movement, you ask him to move a bit, it becomes a bit easier for him, and then also the muscles allow you a bit deeper in. So that's the glute max. Very good to get in there. You can also go into the medial glute over there, and you can feel that's quite sensitive, eh? It's both sensitive and ticklish. So this one again, you can just send slowly. It's going to be sensitive, so just do a little bit, hold off, a little bit, hold off. What you can do is a little bit and then stop. A little bit and stop, and sometimes it's good to kind of add a lot of touch so that the body's comfortable, and then just gently, and that's a bit easier for him to handle. And then also, once you've done a little bit of warm up again, you hold it and then lift the knee for that and relax. There, not too sore, eh? Not too bad. Fantastic. And then in the ITB you can come in here. This is going to be quite sensitive, so not hard. It's just, and then obviously the faster you go, the better. But it's a bit ticklish, right? Yeah. So what you then can do is just with a flat hand, using the little knuckles of your fingers, you can press on there and then ask him to straighten the leg for me, and relax. You feel that? A little bit tender, but it's good. There, and relax. Fantastic. And then right there, and of course closer to the knee will be a bit more sensitive. You can come right there, just not on the knee itself. That's a good way. Now you want to get into, comfortable like that? You want to get into the back. So the pelvis is here. So again, the spine, and then this one is always a good technique, just to go up and down the spine. So this is just all the basic ways of keeping them loose. If they have a specific issue, Obviously, best thing to do is to seek medical advice or go to a physio or chiro, or even come to myself as a sports therapist. And once you've been to them and they've kind of said, no, well, it's not too serious as this, then you can revert back to doing the releasing. And if there's anything specific you want us to ask us, you're welcome to drop us a line. And then just in there, and you'll feel this is quite ticklish. Now with Jewel, this was very ticklish. With Josh, slightly more developed now, it's a little bit easier, but it can be very ticklish. And in fact, when it's more sore, it's going to be more ticklish. Now, it's always going to be more tender getting up here by the between the shoulder blades, where you get to the rhomboids and the back of the traps. So what you want to do is you want to really get in there. What you can do is you can ask him to just grab hold of his arm and just slightly open up. So you see how that scap comes around. Then you're opening up. Now you ask him to pull the arm back, pull it back, keep the arm, no, keep it straight, but just pull it back. There, and then work it. Good. And there, good. And there, good. Then you can relax, and then you can grab hold of the shoulder and you can physically work the shoulder. Now, at his age, we can start getting into the lat. I didn't do this with Jewel. Now, this is a very, very ticklish area, and you can feel he's trying to hold his arm down. So what you do is you hold the arm in that position, and then you just hold there, just like that. That's not too ticklish. Once you go there, it's ticklish, but once you stay there, it's okay. Now you just start adding a bit of movement. And as you add a bit of movement, you gently start just pushing down and pulling a little bit. So you're pushing down and you're pulling a little bit away from the way you're pushing up. So down and towards the hip. Not too sore?
No.
Little ticklish, eh? There. Now, and then when you add your fingers, when you come, as you do it, as you feel comfortable, you come down a bit so that the fingers are now on the lat. And now you can actually add a little bit more specific pressure. With the hand, it's like a general pressure. With the fingers, it's like a specific pressure. Relax down. So then you go back in there. Now I also want to get into that QL. We've spoken about the QL, the quadratus lumborum, a lot in the adult videos. And this adductor, which we've released in the video 1 of the parent-child videos. So once you've released that, then you can go in and work in the QL. So it works opposite. So what leg is that? This is the right leg. So the left leg and the right QL work together. The left QL and the right leg work together. So then you come right off the pelvis and you can come in here. So again, I would normally stand on that side. So what you're going to do is you're going to get your hand in there. You get your thumb right in that little gap between the pelvis and the rib. Very ticklish area. So what you do now, what I like to do is I hold onto the whole body, add a bit of a rock to the body. And as I'm going, it's not too sore, but gently. So I rock this way, and as I pull back, I gently push my thumb in. Just a little jab. Just a little jab. So it's not enough for them to go, oh, but it's enough just to get in. And as you're doing it when you're rocking, it's just enough to, and you'll feel that it allows you in deeper and deeper. And it's not about hard. It's all about, Josh is not too sore?
No.
It's sensitive, but it's never too sore. It's never about bruising or hurting. You want them to trust you and not to hurt them. Well, that's about that for the parent-child videos. I think that covers all the basics. Any specific things you need us to cover, just give us a shout. Thanks for watching.